So it depends on how they're doing. Sometimes patients are really in dire straits where they might need therapy right away and where you might not even have a chance to get a biopsy. In that case, you might have to decide what molecular testing can you do? Can you individualize that molecular testing based on only the cytology specimen and then go forward? Or can you do a biopsy after you start the therapy? And that's a possibility as well. I think you have to really individualize your decision making. It can't be for all comers. Yeah, so molecular testing, still takes time and effort, and we really talk to our patients by saying, we'd like to do this testing to be able to discern if there's some targeted therapy that we can do for them. However, we also take a little bit of a cautious approach by saying it does take 2 to 4 weeks to get the results back. And sometimes you get results back by saying it was not enough tissue. And then you might have to say, we might need further biopsies. But if they've already been diagnosed, let's say 2 to 4 weeks prior, and now you're going to wait another 2 to 4 weeks, I'm not sure our patients have that time to wait. As long as patients are tolerating that cytotoxic therapy, as an example, we continue, and then we'll repeat the scan. And if they're responding, then we actually continue the chemotherapy. And then keeping in the back of our mind that they might have an alteration that could be responsive to something else, but that can be added on later. But we don't change the therapy direction as long as they're doing okay. But if it's too toxic, then we might stop that therapy and then start something else.